The pros and cons of deviated septum surgery. First of all, we should define some terms. What is a septum? So your septum is a structure that's on the inside of your nose. It divides the two sides of the nose. It's made of cartilage in the front and bone in the back. And so whenever we say it's deviated, that means it's not exactly in the midline, but it's bent over to one side or the other. This can be for a number of different reasons. Some people, that's the way they're born. Some people, we think part of the birthing process, you have some trauma to the nose. Most people, they have multiple traumas over time. When you're a kid, you fall, you bump your nose, you get up, you keep going, you don't even realize that it's happened. But those micro traumas over time make the cartilage kind of curve over. And so there will be one side that's narrower than the other because that's the side that the septum is curved over towards. Usually, the way you'll know if you have a deviated septum is you have one side of your nose that you don't breathe well out of at all, and the other side is okay most of the time. We naturally have a breathing cycle where one side you'll breathe better out of for a little while, for 20 minutes to about 2 hours, and then it'll switch to the other side. So it's natural to have one side that breathes better and then it switches to the other side. When you have a deviated septum, when you're on your bad side, you'll notice that you really don't breathe well. And then it'll go to the other side and you feel like, oh, maybe it's pretty good. And then some people, that side is just always not very good. So a lot of times when you go see your doctor, they'll take a look inside your nose and may tell you you have a deviated septum. What are the pros of deviated septum surgery? The pros are this is a very powerful way to improve your breathing. If you are one of those people that one side of your nose you can't breathe very well of at all and the other side is okay, that you may really benefit from septal surgery, or what we call a septoplasty. Ironically, sometimes it's the side that the septum is deviated away from that's your worst side. And that is because you have structures in your nose called turbinates. These are hot dog shaped structures that are on the inside that heat and humidify the air. But if you have a lot of allergies or you live in a place like Houston where the air is maybe not so great, they tend to swell. And especially if you have a deviated septum that's pushed over to one side, that turbinate on the other side will have what we call compensatory hypertrophy, and it will swell to take up that space. So if you only fix the septum and you move it back to the midline where it's supposed to be, this one will continue to be big and cause breathing on your opposite side. So a lot of times we'll do septal surgery or septoplasty to move the septum back in the middle and have more space on both sides to breathe, as well as doing turbinate surgery to shrink those down. That way you just have more space to get air through and to breathe better. What are the cons of deviated septum surgery? The cons are there are a lot of things that go into how we breathe. And so when you look in someone's nose and you say, oh wow, you have a really deviated septum, I can see that it's curved over to this side and it's really tiny on that side and it's bigger on that side, that may or may not correlate to their level of nasal obstruction. So it's very interesting from a scientific perspective because it's really hard to do a study to say if we fix the septum this much, it improves your breathing this much, because there are other things like turbinate hypertrophy, like allergies that can make just the mucosa in the nose swell, just like perception of air that goes through their nose. So all of these things go into what makes your nasal obstruction or what makes you not breathe as well. In most people, if you have a very deviated septum, fixing it should fix it. It may not fix it 100%, but you maybe get 70, 80, 90% improvement, and to where you're not noticing one side is really your bad side anymore. How bad does a deviated septum have to be for surgery? It depends on the person. Everyone's perception of nasal obstruction is a little bit different. In some people, just a millimeter or two of deviation, when you fix that, it makes the world of difference. In other people, if it's really deviated and you make it pretty close to the midline, it's hard to make it 100%, you know, they may tell you they have a 50% improvement. So it's really difficult to say, but in general, if you have one side that's really, really hard to breathe out of, and you look in there and it's really deviated, you should have improvement with the surgery. There are other things that go into this as well, what we call internal nasal valves. So this is where the bone ends and your cartilage begins here. So this little cartilage where it comes together with the septum on the inside, if it's narrow, you can really feel this because this is the narrowest part of your whole airway. So this should be 10 to 15 degrees. If it's just a few degrees narrower than that, you'll really feel it. And so sometimes if you fix the septum, you fix the turbinates, you may still have some nasal obstruction because of the internal nasal valve. And that is a lot of times when people come to see me as a facial plastic surgeon, maybe they've had their septum fixed, they've had their turbinates fixed, and they're still having some nasal obstruction because that valve is a little bit narrow. So that's something that we can fix with grafting, where I take cartilage from one part of your nose and put it into another and just kind of move things around to where it's in a more favorable position and you're able to get more air through. Is deviated septum surgery worth it? I would say yes, deviated septum surgery is worth it in the vast majority of cases. Like I was saying, your perception of nasal obstruction is different from everyone else's, and so it's hard to say 100% that fixing the septum is going to absolutely fix your nasal obstruction, but it should make it a whole lot better if you do have a deviated septum, and it's something we can look in there and examine and see. You should physically have more space on that narrower side to be able to get air through. And being able to breathe through your nose is much more efficient than breathing through your mouth. And so a lot of my patients will say after they've had septal surgery, they sleep better, they can exercise easier, they're not out of breath quite so much. It can affect a lot of other things that you don't necessarily even realize. Have questions? Call or email anytime. I help people like you every day and would love to talk. Thanks for watching.